So today's session, we will focus on life as a graduate student at the USC School of Gerontology, and we have some special guests that I cannot wait to introduce you to. First and foremost, to start off, we are the nation's premier school of gerontology. We're the oldest and largest institution to study gerontology across the lifespan. So we look at everything from birth to death and everything in between. Our main mission, Our main mission is to create the next generation of leaders in the field of aging, and I'm excited that you are all here to join us and to be the next generation of leaders. So we offer, we're located in Los Angeles, We're located in sunny Los Angeles in a very prime location. So we are located near downtown Los Angeles, near Santa Monica. If you want to go down south. If you want to go to downtown LA, that is also very available. So we are excited to introduce these panelists. First, we have Dr. Aaron Hagedorn. He's a professor of gerontology and an internship coordinator at the school. We also have Natalia June, who's one of the alumni from our programs, as well as a current student, Amor Mathershed. So first, I'm going to introduce Dr. Hagedorn. He teaches essential classes such as Perspectives of a Changing Society and an Introduction of Aging, Global Health and Aging, and the practicum courses for both undergrad and graduate students. His research includes training skills for careers in gerontology and healthcare, technology design to support these aging with disabilities, regulatory issues, and affecting long-term care providers and global health and evidence-based programs to support those with chronic illnesses around the world. So I'll hand it over to Dr. Hagedorn.
Thank you so much, Angela. It's an honor to talk to you guys. I first walked through the doors of the school in 1996, and I was just amazed by the fact there was a School of Gerontology and the amazing, really nice people in the program. And I just felt at home in this school, and my mind just opened to the wide possibilities. So I ended up doing 3 internships, actually. One as a nursing home administrator, one at the University of Hawaii, and one on a research study, and one in Washington, D.C. at AARP's national headquarters. And each kind of drew me in totally different directions. And now I'm really excited because I get to help place our students in 400 different locations where we have agreements where you can do your internship. So if I can have the next slide, please. So broadly speaking, I mean, there's no limit to what you could do with a gerontology degree. You can spin it in many different ways. Most of our students do something in program administration, whether that's running an organization or an aspect of an organization. You could work directly with policy through organizations like AARP or organizations like the American Healthcare Corporation or Leading Age or California-based foundations. You can work on your own and as a care manager independently, being able to charge people over $100 an hour for your work with some training that you can get through an internship. Obviously, there's work in assisted living. There's work in nonprofit management, real estate development. If you want to go to law school one day, we have lots of connections with people that get you working in internships that will prepare you for law school. We have connections with the law firm, Betzedek, as well as the National Center for Elder Abuse, where you'd be involved working closely with lawyers. If you want to go on to medical school, we have a number of connections that will get you involved in research or clinical experiences, preparing you for that. And there's a number of foundations that our school has a long connection with, like the Archstone Foundation, and you see some of our alumni kind of spaced throughout the PowerPoint. Next slide, please. And Angela, I see a hand raised. Do you want me to call on that, or?
We will have a Q&A at the end for students.
Okay. So I mean, the first internship site I chose to highlight here is called Arosa, and it's a high-end care management company that several of our students have done internships here, and then gone on to start their own care management companies. And there's something called the Aging Life Care Association that hosts an annual meeting each year nationally, and they offer a free scholarship for our students to attend that meeting. And then there's local gatherings, networking gatherings throughout the year that the president of the Aging Life Care Association, Victor Alcala, is one of our graduates, and he welcomes our students to come and meet care managers. And the advantage of going to those meetings is even if you're not interested in care management, you can meet people who know everybody in the long-term care field because it's their job to refer people to nursing homes and assisted living and home care agencies and the like. So if you're looking for jobs, connecting to care managers is one way because they know a lot of people and can help make those introductions. Can you get the next slide, please? The next organization where you could do an internship is called Human Good. And it's a senior housing company. They have one division that's overseeing like implementing technology for older adults and many high-end market rate senior communities throughout the Southern California area. And I just want to illustrate what a nice organization it is in terms of how they treat their employees. So this is what the benefits that they list on their website. And what I find amazing about the gerontology field is it attracts people who have a good heart, they're motivated to help people, and they take good care of the people in their field. This just illustrates the benefits of working for a company like that, like Human Good. Okay, next. Another organization that's run by our graduates is the Front Porch Center for Innovation and Wellbeing. They have agreements to work with technology companies to test out their latest products on older adults and get their feedback. And they're doing interesting work with virtual reality and with fall prevention technologies, and various forms of brain training kind of games. Next. I want to highlight that if you're looking for a place to live in Los Angeles, you can live for free at Kingsley Manor, which is a senior housing in Hollywood, California. If I get the next slide, please. This is a continuing care retirement community. They have people at all levels from perfectly able to highly disabled. And what they do is they allow our students to live there for free on the condition that you work 20 hours a week as a flex employee doing whatever role they need, be it the front desk or doing tours for prospective residents or activities. So it's an interesting opportunity that we've had since the 1980s. And the students that have done this in the past have gone on to be leaders in the field pretty quickly because they really understand what it's like in these communities. Can you get the next slide, please? Next company I want to highlight is called Momentum Senior Living. And this is a management company. They manage many high-end senior livings throughout the country. And if you do an internship with them, then you're going to get to know kind of high level how it is to run a major corporation. And every semester they adopt a few of our students, and the leaders of it, Jim Biggs and Josh Johnson. They've been administrators in this field for many years. They even ran buildings in China for a number of years before coming back to start their own management company here. And they give students kind of a really high-level exposure to what it's like to think as a corporate leader, and they have connections through their decades in the field. Next slide, please. Another company we have close connections and do internships with is called Silverado. It's they do senior housing for people with dementia, and they're really excited about doing evidence-based interventions that help people with dementia to have a really high quality of life. And they have facilities in Beverly Hills and in beach cities that are take a couple of our students each year. And just today, in fact, they hired one of our graduates who did his internship there last spring. So, the good thing is these organizations have a long history with us. The founder of this organization is on the board of the Gerontology School, and just illustrating we have really strong connections at some of the top brand names. Next slide, please. If you're interested in justice or planning to go to law school, USC has its own Center for Elder Justice that's funded by National Institute of Justice to oversee elder abuse investigations and research. And students that have done their internship here have gone on to get to meet some of the leaders in adult protective services and in the city government, as well as the county government. So if you're interested in a career in government, this is one pathway to get in. Next slide. PACE programs are a growing part of our field. These are a type of managed care organization that takes full responsibility for all of the healthcare needs of a person, all their doctor visits, hospital visits, nursing home if needed. But they're trying their best to keep them at home in the community. WellBe Health is one of the fastest growing PACE organizations, adding several new sites each year. There's other organizations like Scene Health and Chinatown Service Center and Ultimed and the Jewish Home for the Aged that offer the same kind of program. And these sites have been growing, and they've hired, I'd say, probably at least 15 of our students in just the last semester. So, some of them will even sponsor work visas for international students. So I see PACE as a great model where you can learn about healthcare. It really is a healthcare facility and a managed care organization, but they operate kind of a small scale of somewhere in the neighborhood of 100 to 200 people. Next slide. At the larger scale, there's Scan Health Plan in Long Beach. And this is the very first health maintenance organization serving Medicare that focuses on taking care of people's social needs in addition to their medical needs. And they've hired a number of our graduates that have gone on to become vice presidents at Scan Health Plan and other Medicare managed care companies. Right now, more than half of older adults are enrolled in Medicare managed care and not traditional Medicare. So this has been a growing industry. The pay is good, the job stability is high, and you're using care coordination techniques to keep people out of the hospital and delay any kind of institutionalization. So it tends to align very well with people's interest in helping older adults. Next slide, please. There's consulting organizations that you could work with as well. Health Services Advisory Group is a Medicare quality assurance organization. So any hospital or nursing home that fails an inspection from the Department of Health Services needs to work with the Health Services Advisory Group to create a plan of correction. And it's run by many of our graduates, and each year hires a few of our graduates to be consultants helping hospitals and nursing homes to ensure they're following regulations. This is a great internship if you're interested in government, policy, regulations, safety, advocacy, any issue where you're doing high-level administration that's having an impact on a lot of people. Next slide. So as I say, we have about 400 different locations where we've placed over 1,500 interns. Most of them are in the Southern California area, but we can create new ones as necessary. We have them well established in Washington, D.C. as well as many virtual ones that can, where the corporation may be based in another place, but you can do most of the work online. We even have one where the company is based in Baltimore, but they will fly you out to different states because it's a Medicaid consulting company, and they work with states one by one and do consulting services. And so you do most of the work from home, but then you might get flown out to a state Medicaid office for a meeting. So every internship is a little bit different. You see some of the guest speakers that are all graduates of our school, former students of mine or classmates of mine. They've all gone on to have careers of great influence. And so it's been my experience that most of our students are able to find a job right after graduation through their internship or connections that they make through the internship. In our internship course, we bring in a variety of professionals that most of them are alumni, but all of them are leaders in the field. And you'll get a sense of the wide range of careers that you could do, either right after graduation or work your way up towards throughout your career. If you have any questions, my email is there, and I'm happy to answer any questions. Thank you.
Yes. Thank you so much, Dr. Hagedorn. That was really great information, teaching students about the different placements that they can go to, all the 400. Wow, that's a lot. So thank you so much again for your time. For those that joined in a little late, my name is Angela, one of the admission counselors, and we are having a raffle for an application fee waiver for our programs. So if you would like to participate in that, please put your full name and email in the Q&A section. It could be anonymous if you prefer. And that way you can be considered for the raffle, and we will choose a lucky student very soon. So next, I will introduce our alumni, Natalia June. Natalia is a graduate from both our Bachelor's of Science in Human Development and Aging and our Master's of Science in Gerontology. And she now works at Heritage PACE as a Quality Improvement Coordinator. So without further ado, I'll hand it over to Natalia.
Hi, everyone. So nice to meet you all. I'm so excited to be able to talk about my experience with the Gero program. I did my master's and my undergrad at USC. So this is, I'm really excited to get to talk about this. So while I was in the program, I was part of the Student Gerontology Association. I served as the undergrad student representative. There is also a graduate student representative, which is, I think, what you guys could qualify for if you ended up joining the program. We host a huge alumni dinner at the end of the year. It's a great networking opportunity. There's a lot of speaker events that you get to plan. You get to ask your professors or professors you've maybe never had an opportunity to take a class with to come and do a talk. The Gero School has so many great resources that you get to kind of draw from and create with. So definitely take advantage of that. And then just wanted to also highlight another club on campus called Glamour Gals. If you don't want to get involved in any of those awesome internships that Dr. Hagedorn mentioned, Glamour Gals is a student-run organization. They go and they provide manicures to older adults living in retirement communities as a way to kind of bridge that gap and decrease senior loneliness. So we can go to the next slide. I think what I really am excited to talk about, though, are the gerontology Maymesters that USC offers. I think Davis does a really, really good job of having lots of different opportunities to go on. I know that there are some to Italy, Korea, Colombia. I didn't have it mentioned here because I did the Colombia Maymester as an online Maymester during Zoom in the pandemic, so it's not here. But yeah, let me just talk really quickly about the two Maymesters that I did actually get to visit on. We can go to the next slide. So we got to visit Costa Rica. That was one of the blue zones. There's 5 blue zones on the planet, and we got to kind of see and get a taste of what they live in, the way that they live, where they're living, what they eat. And Costa Rica is such a beautiful country. It was a privilege to get to visit and see the way that they handle healthcare over there. I think our country has a lot to learn, and we can always be improving and growing. So it was very cool. This is the hotel that we stayed in Nosara, and it was just absolutely beautiful. We can go to the next slide. This is an example on the left of one of the meals that we got to have every morning at breakfast. They have a lot of fruit. They have not too many carbs or protein, and they have like a very, very big walking culture. So everybody walks everywhere, and it's just a very active community. We got to take a lot of cool excursions, go out, try lots of different foods. One of the big things about the Blue Zones is how they eat and diet. And so we definitely got a huge sampling of that. And so that's just one of the really, really cool opportunities that you can get as a study abroad, as one of your, what's it called? Your not extracurriculars, maybe as part of the gerontology master's program. We can go to the next slide. I also had the opportunity to go to Israel with the gerontology program with Dr. Mather, and we were kind of exploring just how Israel's self-reported happiness levels are so high, considering that it is consistently been a place where there's a lot of war happening, but they have very high male life expectancies. And so we had the opportunity to visit Jerusalem, visit Tel Aviv, visit the Holocaust Memorial there, and just see what the Mediterranean diet is about. And they also have very, very high life expectancies, and the Mediterranean diet is one of the most commonly referred to diets that's promoted for longevity. So yeah, it was great to be able to just see how everybody's lifestyle is there. We got to do a research proposal as our big project. So that was very cool to be able to evaluate just the differences between Israel's lifestyle, American lifestyle, and see how we can maybe improve and change some of the ways that we do things here so that we can improve longevity. Yeah, and that's all I have. Thank you so much.
Yes, thank you so much, Natalia, for sharing your experience with the different organizations you were part of, as well as your study abroad experience. How exciting. So next, I will introduce Amor Mathershed. So Amor is a current student in our Masters of Science in Gerontology program. She recently graduated just this spring from the Bachelor's of Science in Human Development and Aging. So we're so excited that she's continuing on with this Masters of Science in Gerontology. And I'll hand it over to you, Amor.
Yes, hello. Nice to meet everybody. I'm so grateful that I'm continuing my studies on with gerontology and able to hone in on specifically what I wanted to do within the field because it really is such a vast field. And like with help of professors and like how Dr. Hagedorn was saying with internships, you really do get a wider gauge on what you want to do within the field and get more real life experience. So next slide. So again, I wanted to talk a little bit about the internships through Giro. So a lot of what Dr. Hagedorn was saying, we do have a lot of connections. But for my internship last spring, I chose Wallace Annenberg GenSpace. So Annenberg is kind of a household name in USC or in Andy Value's house, especially because we have the School of Annenberg. But in this internship, I was able to get real world experience working with older adults. It is a community center that fosters growth and connections between older adults so that they have a place to go and somewhere to be seen and not have to stay at home all the time. My specific initiative was to incorporate more tech-based classes and workshops within the space. So we kind of see this disparity where there's a lot of older adults who don't know how to use certain technological devices and that are willing and want to learn. So I incorporated that within my studies and taught classes to them. So whether that was through brain health games like playing something like Kahoot, which seems trivial to us, but was very fun and engaging and a learning and teaching moment for them. Or even, teaching them how to use Instagram or Pinterest or TikTok. There's such a wide range of older adults who want to learn like more technology and more applications. And so just being able to foster their growth and help them with that. Next slide. I also was in Student Gerontology Association. I think that it's an amazing club to be a part of, especially in the School of Gerontology. You're able to speak about different initiatives that you would like to take within the school and also just have a dialogue with people who are like-minded with you about the aging field and get more insight into other students. We do have, multiple majors within the undergraduate department. So, whether that's health science or social science or lifespan health, just looking at the different things that you could talk to with other students and be able to get more insight on. So some of the things that we did, I was the marketing chair last year, and what we did was we created the flyers and helped set up events. So we have a lot of cultural events. On the top right, it's one of our like Halloween general meetings where we were able to paint pumpkins and paint on canvases. We also have just regular general meetings where we're able to talk about what we see ourselves doing in the future in this field of gerontology and just different ideas that we'd like to bounce off of. Again, what matters to me, there is an undergraduate and graduate what matters to me where it's essentially a forum where professors come in and speak about their experience and how they got into the School of Gerontology, how they got into their field of study, and you're able to get more insight into kind of what you want to do and if you want to take on what they've kind of done. And yeah, the alumni dinner also, we help do that at the end of the year where students and alumni and faculty are able to celebrate kind of like an end of the year thing. There's also Walk to End Alzheimer's, and we have a lot more events that we go to and plan, all available for the students to come and join. So our Instagram is USC SGA, so you can follow us and just be up to date on what we're doing on the day-to-day within the semester and within the year. Next slide. So I wanted to talk a little bit about research opportunities as well. I am part of Dr. Brown's lab. So essentially we focus on Black health and aging, along with focusing on the aging process for other marginalized groups. I used to think that I couldn't do research because I was in human development and aging, but I was on the social science track, and a lot of people do research for more medical field or more health science. But this is a social lab where you're looking at demography and biodemography and aging. So I was able to give my insights, and we even, wrote a paper together. We were able to do poster presentations, which helped my speaking skills a little more and just get more insight into the field of gerontology and whether I want to go into research in depth. So yeah, if you're not thinking about doing something more like health, there are always opportunities, and you could always ask professors if they're looking around for more members in their labs, and just getting a gauge on whether or not which professors you want to work with. And yeah, there's always opportunities if you just ask around, and you'll find someone. Okay, next slide. And then for study abroad, I went to two, but for the first one I'm going to talk about is the UK and Ireland. So we went across 4 countries, four countries in 2 weeks. So it was pretty rigorous. We were in England, London, England. We went to Edinburgh, Scotland. We went to Belfast, Northern Ireland, and then we ended off in Dublin, Ireland. And within that class, we were able to study different effects of aging in a different country. So a lot of it was comparisons between how we age in the US and how they age in the UK and Ireland. So one of those studies that are worth looking up and everything are Healthy Aging in Scotland. It shows a cohort of people aging in Scotland 50 and plus, and their lifestyle and what has taken them to achieve longevity, or if not, seeing what circumstances might have led to that on a country level, and also comparing it to different countries, seeing how different lives are lived. And similar to Tilda, but it's essentially like an Irish study. So the Irish longitudinal study on aging, it's essentially the same, but just within a different country. So you have a higher cohort or a different cohort that you could compare it to. And a lot of the trip, it's still a class, so you're studying, but you do get a lot of free time, and you're able to engage with students, engage with the culture, engage with the people, with the country. So it is very fun. Highly recommend. Next slide, please. And then the one that I recently went to 2 months ago, this past May, was the study abroad in South Korea. This was similar to the UK in the way that we focused on older populations in South Korea and how they're aging differently within the US than the US, and also what factors that in. So we were able to go to universities like Seoul National University and hospital and speak with their presidents and talk about the different research that they're doing, which is incorporating assistive devices more into nursing homes, or allowing it, or just bringing it to homes in general of older populations who need that. And then also age tech for human enhancement. So we talked about things about like organoids and cancer research, and how it could also help predict Alzheimer's, and just doing different studies and different research on how they could take more preventative measures to look at cognitive decline. And then also, again, we did have a lot of free time, and we were able to look at effects of diet and culture within the course. We were able to visit a lot of senior centers. So one of them was Gangnam Senior Plaza, where we were able to present to have a little presentation where we're able to talk about some longevity aspects and what all the seniors in that facility were doing in order to maintain a healthy life. So yeah, I have some pictures there. We also had a lot of fun in Hamburg. We all got to try on. The professors were amazing in teaching us and showing us some more cultural practices of Seoul. And yeah, we stayed in Seoul for the majority of the time. And then we took a little field trip to Andong, which is a little bit more rural. So we got to see the differences between how people in the city aged versus how people in a more rural area aged within a different country. So, thank you. That's all I have.
Thank you so much, Amor, for sharing about your experience, both at SGA as well as in studying abroad classes. Both sound so fun. Yes, so now I will quickly go over what the panelists have mentioned regarding the study abroad classes and other student opportunities. Firstly, we do have 13 different graduate programs as well as 2 fully funded PhD programs. So, they are here listed above. Our newest program is our Masters of Science in Aging Biology. Just wanted to mention that. So with the study abroad classes, as mentioned earlier, we do offer short-term study abroad classes, and they are called either Maymester or Julymester. Both are in the summertime, but just depending on which one you choose is when they will be offered in your kind of curriculum in your course outline. A Maymester is a short 3 to 4 week program, which is after your spring semester. So typically it starts in the end of May and goes on until the middle of June. The Julymesters, again, very similar, but starts in the middle of July and ends in the beginning of August, right before the fall semester starts. And that's how it correlates with your tuition. If it wanted to be in the spring semester, it would be a Maymester, or the fall semester, it would be a Julymester. Okay, so we offer 5 different study abroad courses at the moment, and I will go over each of them. So first, Gero 498, which is Nutrition, Genes, Longevity, and Diseases. That takes students to Italy. It explores how nutrition and genetics influence longevity and age-related diseases. Students learn from a renowned expert, Dr. Longo, while gaining global insights and experiencing a month-long immersion in the Mediterranean lifestyle. Next, we have Gero 493, Longevity and Death Among Ancient and Modern European Populations. So that is led by Dr. Susan Ingidanos. So that course explores how ancient human remains reveal connections between diet, health, and disease. Traveling through Italy, students examine how religion and culture shape death practices, ceremonies, and beliefs about the afterlife. Okay. Gero 489, which was mentioned earlier, takes students to different blue zones, 2 different blue zones, one in Nicoya, Costa Rica, and the other in Loma Linda, California. And it immerses students into the lifestyle and showing how to improve the quality of life and extend the lifespan by studying the populations in those blue zones. Gero 478, Genetics of Aging in England, Ireland, and the United States, takes students to those places and studying the environmental and genetic factors of longevity and health, exploring folklore and fiction to understand the history of genetic studies and examine 3 longitudinal population studies within their cultural context of aging. And Gero 499, students travel to South Korea to explore how culture, policy, and lifestyle change and shape longevity. Through expert talks, hands-on culinary experiences, and visits to historic and modern sites, from the world's longest life expectancy to the lowest fertility rate, discover how this rapidly aging society is defining or redefining the future of healthy aging. Awesome. So, as mentioned earlier, we do offer various student opportunities for our students to get involved in. There are many, many more opportunities within the university, but here at the School of Gerontology, we do have a few. We have the Student Gerontology Association, which is a group of undergraduate and graduate students that create and start philanthropic and social events throughout the year. We do things like the SGA Walk to End Alzheimer's. There's also the spring end of the year kind of dinner that we host, or the students host. So a lot of events throughout the year, and they get really close and get to connect and form that network that is really important and really very much popular in the USC community. Okay. We have every fall and spring semester, we have colloquium lecture series, which is where we bring outside faculty members or outside faculty from other universities, and they discuss their research in aging. And it's a great opportunity for students to, again, build those connections with faculty outside of the university, within the university and their peers, but also get to learn research that is outside of USC. Okay. A fun experience that is available for students is yoga with the dean. So our Dean Cohen brings in his personal yoga instructor every Wednesday, and students, faculty, staff are more than welcome to join in, where they do yoga and meditation every single week. Okay. As mentioned, there are opportunities for students to get involved with community service. So as mentioned earlier, there was Glamour Girls, there's also Project Angel Food, and USC Advocates for Healthy Aging, and Hilarity for Charity as well. But many, many more. Okay. We hold many events throughout the year to celebrate different holidays or cultural events. So we celebrate events like Lunar New Year, Christmas, Halloween, Thanksgiving. We've celebrated all throughout the year, every single month. Basically, there's like a wonderful event for students to connect outside of the classroom with their faculty and start building that network. Excuse me. Okay. So these are our admission counselors. If you have any questions, feel free to include them in the Q&A section, and we could answer them live with our panelists or in the chat as well. So feel free to start inputting your Q&As. I do have some questions that students sent beforehand to Dr. Hagedorn. Okay, how do you help students find internships that match their specific interests, such as like policy or research or technology in the aging population?
Yeah, that's a good question. So we have a wish list system where you can look through our database and choose the organizations that sound most interesting to you. We have a kind of initial interview with you where we get a sense of what are your unique interests, and I might suggest something that's even not on the list based on people that we've met at conferences or that we know through our network. So it's a combination of looking through the list of options and discussion where we try to find something that's going to work for you.
Yes, and then students were also asking if they are strictly semester-long internships or some are maybe available in the summer.
There is a summer semester as well, but yes, generally they're semester-long internships. We have one program like dual degree programs where they're year-long internships because they have to do more for the dual degree, but generally they're one semester.
Awesome. Okay, one student was asking if study abroad classes are available for PhD students. That is a great question. I believe that would be at the discretion of your faculty member, your advisor. We have seen PhD students attend in the past, but like I said, that since PhD programs are very unique programs, that is under the discretion of your PhD advisor. Let's see. Okay, I have two questions regarding living at Kingsley Manor. So is it available for undergraduate students or is it strictly for graduate students?
Historically, it's mostly been graduate students because graduate students have a lot more availability. You're only in class like 12 hours a week total versus undergraduates tend to be in class a lot more. That said, we did have one undergraduate for whom it worked out, but it's a matter of being able to offer that 20 hours a week work. If you're interested, send me an email and we'll introduce you to the administrator and you can interview and see if they're willing to consider.
Yes, thank you. Yes, so yeah, as you mentioned that it is with, yes, okay. One student asked about TA opportunities. So yes, that is again also at the discretion of faculty members if they have availability to have a teacher's aide or teacher's assistant. So that would be if once you are a student and you are interested in becoming a TA, we would recommend reaching out to that faculty member to see if they have availability. Curious about the current rates. Let's see. Okay, curious if you offer internship placements at institutions that focus on older adults and PAT, potentially in collaboration with USC's IIHW. Dr. Hagedorn, let's see. Well, we do offer, as Dr. Hagedorn mentioned, we offer 400 different sites where students are able to do their internship. So there more than likely will be an opportunity for you to do your internship at a location or a specialization, a topic that focuses on what you want to do. Yes.
We can always create new internship sites. We're not limited to just those.
Yes, definitely. Yes. There's always, we always talk to like different administrative or senior living facilities that want more students as well. So we love it to create that connection with USC and our students. Let's see. Let me just take away these questions so that they don't get in the way. Okay, so one student asked regarding the Bachelor's of Science degree being admitted if you have a psychology degree. Yes, so we take students of various backgrounds to our graduate programs. So we've had many students that have a psychology degree or psychology background, sociology background that get admitted into our programs. Psychology is actually one of our core disciplines in our programs. So we look at it also through a psychological lens. So thank you for your question. Let's see, I'm curious about current rates of employment. Okay, cool. Dr. Hagedorn, can you go a little bit in more depth regarding the employment rates for students that have done internships or recently graduated that have gotten employment from internships?
Yeah, I'm actually have to track employment stats. So I can tell you that around 60% of the students get a job right after graduation. That is usually either the internship hiring them or the internship referring them to a partner organization where they get hired. Another 20% find a job within 3 months. And then there's another 20% that it doesn't always happen right away. But we can set you up for informational interviews. And employment depends partly on where you live and how flexible you are and where you're willing to live. But I say that our students have no problem finding jobs. It's just a matter of doing well in your internship and making good, building your network during that time.
Yeah, awesome. Okay, and then for Amor and Natalia, if there is a student that is still hesitant on whether or not they want to study abroad, what is one piece of advice to help maybe encourage them to do so?
I would say that study abroad was actually the most fun experience of my entire degree. It's very small class sizes. My class that went to Israel was 7 people. Costa Rica only had about 12. I would encourage you to do it just because you'll get really close to people that you might have been in class with before and never got a chance to really talk to and spend time with like that. And I think everyone who's in the gerontology program is actually so wonderful. You have to have like a certain type of heart to want to study gero. And so I think that's, yeah, if that can be any encouragement. And the food is also really good, all the places that you get to go.
Awesome. Yes, it definitely sounds super fun.
I just wanted to add on that, also like getting that perspective on different countries, I think is very beneficial, especially when learning about different studies in different countries, and in regards to aging, because you know we are part of this aging world. So just getting to know like how people age differently everywhere, and then also our study abroads are, you know, they range like no longer really than a month. So it is a more flexible option and a better option than, say, you know, going out for 5 months for a whole semester abroad. We're one of the schools that offer that, you know, short-term study abroad, so you could get back home. You don't have to stay out there for a long time, but you still get that immersion into the culture and how different populations age.
Yes, definitely. Yes, the short-term study abroad is definitely a great option for students that don't want that full commitment of a full semester. So thank you so much to all the panelists. I believe there is still, our team is typing up some answers for students, but I will share lastly our screen with the QR code. So if any students have any additional questions, we got all the attendees hopefully. And if you have any additional questions or want to be connected with any of the panelists or with the admissions team, feel free to scan the QR code, and that has our main email as well. But I want to thank everyone so much for attending, and thank you so much for the panelists for dedicating some time to help teach students about the different opportunities and life as a USC Leonard Davis School of Gerontology student.